Hello, everybody. Welcome. I'll give us a couple minutes to let everyone in from the waiting room, then we'll get started. Okay, looks like we're all here. Thank you for being here today. This is our Veteran Oral Health Virtual Road Tour stop in Illinois. Our agenda today, we will start with an introduction, an overview of veteran oral health, a national overview. Then we'll move on to veteran oral health in Illinois. Then we'll have a discussion. We want to hear from you. We want to hear solutions, feedback. We want to hear your thoughts. And finally, we'll end with a conclusion with some action items and next steps to veteran oral health. Next slide. A few housekeeping pieces. We are recording the session and we'll have the recordings available afterwards on our website along with the slides and other materials. At this point, I want to invite you each to type your email and organization in the chat so that we can get to know you better today. So I'll give you a minute to do that. And if you have any questions, please do feel free to write them in the chat and we will get to them as soon as possible. Next slide. These are our learning objectives here today. These were provided in the registration information and are attached to our CEUs. Next slide. Our presenters do not have any disclosures to share today. Next slide. And with us today is myself, Samantha. I am the Community Education and Outreach Coordinator with AIDPH. Our Director of Education and Leadership is Liz Flannery, and she will be presenting today. I will give a special thanks to Megan Ryder for bringing us all together today. And without further ado, I will hand it over to Liz.
Thank you so much, Sam. And thank you again to everyone for being here today, introducing yourself in the chat. As Sam said at the top of this call, we really want this to be an interactive session. We'll be sharing information about veteran oral health across the nation and then specifically with Illinois. But really, we want to hear from you of how this translates to what you're seeing as local stakeholders on the ground doing this work, working with the community day in and day out. So we'll have specific discussion questions at the end to dive into this information a little bit more. But as we walk through, please feel free to pop questions in the chat, chime in with what you're thinking and what you're seeing as we walk through the information. We can head to the next slide. Before we go into specific veteran oral health information, I just want to give a little introduction to American Institute of Dental Public Health, or AIDPH. Our mission is to empower our community to advance oral health through science, education, and advocacy. And what we're doing here today is really the intersection of those three pieces of our programming. And we're doing that mission. Our vision that we're working towards through doing this work is a justice-oriented oral health system. We can head to the next slide. So at AIDPH, we have 4 communities of focus. These are communities that have been historically marginalized, excluded, and underserved, particularly when it comes to oral health. These communities include veterans, which we're talking about today, people living in rural communities, LGBTQIA+ people, and people with disabilities. Also recognizing that there is intersection between these communities. So veterans with disabilities, veterans living in rural communities, etc. And we'll dive into that a bit more as we get into the specifics of the data we're looking at today. We can go to the next slide. We want to take a minute and thank CareQuest Institute for Oral Health. It's a funder for this project. We can head to the next slide and just take a moment to look at our partnership with CareQuest and the work that we've done with them. We've been partnering with CareQuest since 2021 to collect, publish, and produce data reports and resources for organizations like yourself and other states and federal stakeholders to really have translated data resources to help facilitate the work that they're already doing in their communities and really helping us create more evidence-based framework for the work that we're all doing collectively to advance veteran oral health. So again, thank you to CareQuest. If you have any questions or information about the reports and the projects we've done with them, please let us know. We can head to the next slide. So we're going to start with an overview of veteran oral health in our country. And I know for some of you on this call who are working with this population and in this work day in and day out, this might be a little bit of a review for some folks, but honestly, what we found is that most people actually don't understand the medical benefits and dental benefits that veterans have, frankly, to include veterans themselves. So we really like to start there with the level setting of what we're looking at for access. And kind of dive in there. So let's start with that kind of national overview. So benefits, what care veterans can and can't get, how much it costs, and where they're able to receive care is actually determined by Congress. So it's ruled through Title 38, where eligibility for medical, dental, and other primary care benefits are all determined through federal code. And that can only be changed with a vote through Congress. And along with a change in that vote, if we were changing what that looked like, there would also have to be funding to be able to expand access to those benefits. So a change to the federal healthcare system as it relates to VA dental care often requires federal legislative action. We can go to the next slide. And this is a kind of a nice graphic of what veteran healthcare looks like in our country. There are 18 million veterans in the United States, and of that 18 million, about 9 million receive healthcare from the VA. Of that 9 million, only 1.8 are eligible for dental care. And of that 1.8 who are eligible, only about 582,000, or a third of them, are actually receiving that dental care. So if you look all the way over to the left of this graphic and see that red piece right at the end, that tiny little piece, that represents the amount of veterans in our country who are actually receiving dental care through the VA system. We can head on to the next slide. So we want to talk a little bit about chronic disease in veterans. Veterans in particular with heart disease and diabetes experience a higher rate of dental issues. And unfortunately, what we also see is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth, even if they're experiencing dental visits within the past year. So even among veterans who are accessing dental care and are able to visit a dentist, they're still receiving some of the worst oral health outcomes. And that's because these chronic disease conditions aren't really managed in an integrated care environment. And again, when we look at the VA, it's the largest integrated healthcare system in our nation. And so the VA is actually the best positioned to be able to meet the chronic disease conditions and the complex medical healthcare needs of veterans. But most veterans aren't eligible for that dental care piece like we just saw. We can head to the next slide. And so just to dive into this a little bit more, this comes from some of our most recent research, and just to see what this actually looks like. So again, this came from research that was done in partnership with CareQuest. And we're really honing in on those chronic disease conditions because even after controlling for factors like income, education, and morality, veterans with diabetes were still 40% more likely to be edentulous or to have lost all of their natural teeth than veterans without diabetes. We can go to the next slide. And when we're looking at veterans with heart disease, we see similar statistics. So equally concerning, when you have heart disease, veterans with heart disease are 30% more likely to be completely edentulous than veterans without heart disease. So this really highlights kind of that intersection of those chronic disease conditions and where there's a really high access need. We can head to the next slide. And something that we want to point out by looking at this is that it's not just about these terrible oral health outcomes and poor quality of life, but the potential overall health impact and the impact to our healthcare management system. It's a very costly situation for healthcare management. And we know that if the VA would expand dental care to veterans, or if dental care can be managed in the context of an integrated healthcare environment, we see that there's a demonstrated cost savings, particularly for these two chronic disease conditions. So again, looking at some of our most recent research, it indicates that for every dollar invested in preventative dental care for veterans is a dollar saved in diabetes management care and $2 saved in heart disease management. So these preventative care dollars really pay for themselves in the additional health care that would be needed in the chronic disease condition management. So I just want to note in here that that's going to be relevant when we go back and look at Illinois and look at the chronic disease conditions there. So just keep this in mind in this cost savings piece as we move through today's information. So where are we getting this information from? Again, I've referenced several times that we've been working with CQI for quite a while, and I just want to remind folks that these resources are available through several different reports and several different resources on AIDPH's website and vetdentaldata.org. And I think Sam just put that in the chat. So if you haven't already had a chance, please take a look there and see those reports and see what's available. This is just a variety of some of the research and resources that we've pulled together for organizations like yours and again throughout the nation for local stakeholders to be able to get tangible information about veterans. And we've worked very hard to put it in, again, that translational piece to make them very graphically appealing so that these are tools that are easily understandable and you can leverage when you're working with policymakers and decision makers to easily show them the impact and the data. Often the data can be really hard to find, so we've taken a lot of time and energy to put them together in an easily accessible resource. We can head to the next slide. So what I want to do is get started on sharing a little bit more about Illinois and a little bit about why we're doing this road tour here today. Again, these are some of the resources that are available on the links that Sam just put in the chat on vetdentaldata.org. And we have some interactive tools there. We have a map. If you hover over the state, you can find that state's profile and report card, which we're going to dive into more specifically in just a moment. These were created for all 50 states. So if you want to get specific relevant information on what veteran oral health looks like in your state, you can do that with the map. And we've also paired that with veteran oral health data dashboard that should give you state-specific insights. Again, it's interactive and really allows you to look at the data in a way that makes sense to you and explore the insights that matter most to the programming that you're doing at your state level. We can head to the next slide. So again, we're going to look at the Illinois state profile more specifically now and what that looks like for Illinois. And a little bit about why we've put these state profiles together. We just want to call out that when we've been talking about veteran oral health across the country, we've heard over and over again from folks, what does this look like in our state? Kind of what are the state specific information? And that's why we've pulled all of this information together in these state profiles. It was in response to what we were hearing from folks on a state-based need. And as we're getting ready to go into the Illinois state profile, I encourage you to click on that link and pull up the state profile so you have it to scroll through as we look at it together. We can head to the next slide. Okay. And the next one. Okay, so when you pull up this state profile, at the very top, we've put a little bit of context around what's going on in your state and also the national coverage of dental care through the VA. And again, as I said at the top of this call, we always put this at the top of our work because most people really aren't understanding that veterans aren't eligible for dental care through the VA. So if you're approaching a policymaker, a decision maker, a grantor, a funder, the first thing that you can start with is that veterans are not getting care in the VA and why it's important to the state of Illinois. Because ultimately, states and other healthcare systems bear the disease burden, the access burden, and the care delivery burden because of the lack of eligibility and coverage at the federal level. So we also went through and highlighted where veterans are positioned in your state. So you can kind of see this chart here with the different colors broken down by county. And then down at the bottom right here, we have Pope, St. Clair, and Pulaski counties are the counties that have the highest veteran population in Illinois. We can also see that there's almost 600,000 veterans in the state, and almost 6% of them are living in a rural county. We know that veterans are disproportionately located in rural areas. And back to that intersectionality point, we already know that people living in rural areas often face a disproportionate disease burden, disability, struggle with access to care, and have unique healthcare needs just in and of themselves from the rurality piece. So we can kind of really see where these disparities and these barriers start to compound each other. And so knowing that veterans are often concentrated in those rural areas, it's really important context for state-based stakeholders to be able to make informed decisions about a care delivery path and how to access those veterans and provide pathways to care and access. We can head to the next slide. Okay, so when we're looking at this information, we're pulling out some state-specific insights here and looking at Illinois versus a national comparison. And this is really important. We wanted to do this because if you're presenting information without the context, it's not necessarily impactful, or it can be hard to understand what those numbers really mean if it's not put into a broader context. So each state profile has the state-specific percentages, as well as that national overview and kind of how the state compares nationally. So something that we also recommend that you can do is you can pull up other states. So if there's a state that is similar to yours, or has a similar system or similar numbers, you can pull that state up and cross compare yourself as well. That's another useful way to use this information. And again, this exists for all 50 states. And I think I primed everyone at the top of the call to pay close attention to those chronic disease conditions because they're high cost, high risk conditions that can be mitigated through better oral health. And because we made that connection in our research, we wanted to give stakeholders information on how to present that to decision makers, to stakeholders, and then hopefully make programmatic decisions to address that. So here you'll find information on heart disease and diabetes, along with information like insurance status and edentialism. And again, comparing your state, Illinois, to national data. We also ranked each state across all 4 of those important disease conditions or oral health outcomes. So you'll know how Illinois is ranked compared to all 50 states. And I just want to note here, it's important to note that number 1 is the worst. So the lower these numbers are, the worse it is, and the higher they are, it's actually the better they are. If you're curious about the methodology we use to present this information and figure out those rankings, we have that detailed on the Vet Dental Data website and are happy to talk about that, answer questions. You can access that methodology if you're interested in the technical pieces of that. We can head to the next slide. So this is our report card, and when we were thinking about ways to make this data translatable and a tool that folks could use if they're looking to write a grant report or looking to talk to a policymaker, a report card felt like a good way to go. I think it's easily translatable to folks. I think almost all of us have been in a system where we're getting report cards. It's kind of something that we automatically know and understand quickly how to assess. So a few notes about how to use this and look at the information. There's actually some really great pieces about Illinois. If we look at the uninsured rates, we have a grade of A there. So congratulations to the Illinois stakeholders. A B on dental visits. And then when we look at diabetes, it gets a little worse to get us to the overall grade of a C. So I think something here is not just to look at those poor grades and try to understand how to address that and change pathways to address those issues, but really look at those successful pieces and have conversations about how did you get to that high grade? What systems in place, what programs and policies are in place in your state. And I'll just note too, when we get to our discussion, part of what we're doing with these virtual road tours and something that we often hear from folks at the state level is, well, what are other states doing? What are those success stories? And something we're working to do is really pull together people's feedback and put together a compendium report that we'll publish in 2025 of the successful pathways that states have found. So if you're someone on here that is working in those pieces and has an understanding of that uninsured piece or the dental visits, we would love to hear about that as well, so we can share that information out to other states who might be looking to improve that pathway. And perhaps some of those success stories, those success lessons can be translated to the other pieces that need some additional work to advance veteran oral health, like the diabetes piece. Okay, we can go to the next slide. So using your state profile, we've talked a lot about putting this information in front of decision makers and stakeholders, putting it into reports. So we've already covered some of these pieces of advocating for policy and changes. The advocacy piece I would note here, you'll see that we have policy as well as clinical changes. And we just really like to note that policy can sometimes sound overwhelming, but there's big policy and there's little policy, big P, little p policy, what we talk about. We have this federal kind of lawmaking, big policy, big P policy changes that can be made. And certainly those are incredibly important, but there's also smaller pieces folks can do, such as adding veteran status to your intake forms in your office. That sounds like a very small piece. It's very actionable. It can be very easy and quick for folks to implement, but it can have a really big impact of understanding that veteran status, of how that clinical care happens and how those veterans are treated. So there's a lot of different pieces there with the advocacy that can be done with this data, and understanding kind of the state of access of different pathways people can take to change. And educating stakeholders. So again, to that piece of, we've really come to this understanding that folks don't have an understanding of that access piece and that eligibility piece of dental care. So I hope all of you here will share out this information. This session is being recorded. So if you have colleagues, peers who you think would be interested in this or could benefit from kind of understanding what veteran oral health looks like in Illinois, we encourage you to share out this information, share the vetdentaldata.org, and really interact with that information and share it widely for education. Again, decision making, it can inform your own work, having this information, understanding the next steps in your programming, and really understand where you want to go to affect change. And then the reports and grants, we spoke to that before about being able to use this data if you're seeking to implement a program and seeking funding. We encourage you to use these tools in any way that would support the work you're doing there. We can head to the next slide. So veteran oral health in Iowa, we want to take a moment and highlight this project that we did in Iowa. This was a project that was done in partnership with Delta Dental of Iowa, was supported this program. And it was an intensive research project that was done over the course of about a year and a half, and we published it early this year. We highlight this because we want to show that there are next steps that states can take if they're really dedicated to veteran oral health in their state and kind of want to look at a deeper dive of what's going on in their state and get strategic recommendations. So again, our science and research team took about a year of analyzing the data, putting it together, giving a state of affairs of what was happening on an in-depth level in Iowa, and then also making strategic recommendations. We can go to the next slide. Of what could be done in Iowa, different stakeholders at different levels and in different roles of what they can do to, again, advance veteran oral health. This year, what we're doing with this program is we are sharing this out in community forums throughout the year in a virtual environment, and we're culminating it in an in-person summit to do some strategic planning, some funding exploration, really helping the local stakeholders in Iowa create pathways to implementing programs and taking next steps on these strategic recommendations. So I highlight this because we just want to share out that there are next steps folks can take to look at their state and kind of understand what those next steps are. If you're interested in that project, we're happy to answer questions. This report is also available on our website, and we've also found that there's some really great things happening in Iowa, particularly around their trust fund and the way that they're working to fund veteran oral health in some innovative ways that some other states I know have found really interesting and have been helpful for the conversations they're having at the state level. So we just wanted to take a minute and share that information, and that can be found on our website. we can head to the next slide. Okay, so without further ado, I was talking at y'all for a very long time. I saw folks were introducing themselves in the chat. I'm not sure if any questions popped up, but we can pause for some questions and we can also move into our discussion questions. We can probably come off of screen share. We can post our discussion questions in the chat, and I'll hand it over to Sam to lead us through those.
Great, thanks, Liz. That was great. Yeah, I'd like to start our discussion by asking this group, were you surprised by the state profile and grading? Are there data gaps that you think should be explored in Illinois? So I'll just give us a minute to see if anybody has a response to that.
I'll kind of get us started and just share some of my thoughts. I was actually pleasantly surprised. I thought C was pretty good for for Illinois. Um, I will say though, I was curious because I live in rural Illinois myself, and I know we have two of our main VA place locations are in Danville, and then there's one in Manteno, and neither of them that I'm aware of have a dental clinic that's kind of under the same roof. And I know that's always very effective when you're thinking about care collaboration, and kind of bundling appointments when you can have a lot of them, done at the same time. So do we have any other VA departments that have dental clinics in Illinois? I'm not aware of any if we do have that.
That's a great question. Thank you, Megan. And I don't know the answer off the top of my head. I will circle back with Annalise and see if she has specific thoughts. Annalise is obviously for those who don't know, Annalise is our executive director, and she's actually located in Chicago. So she might have some thoughts there. I will share that in general, when we were working on this project, it was hard to figure out kind of those VA services per the areas and kind of what exactly that data was just hard to find publicly available. So my thought is that we don't know the answer to that question, but we'll certainly double check and email out if Annalise has a more specific question. And also just a point of kind of understanding that information could help us a lot in understanding facilitating transportation programs, other pieces that could be helpful, but it's kind of hard to dig into.
One thing I'm going to kind of piggyback off of that too, because I teach an innovations in rural health course. And actually, this Tuesday evening, one of our discussions that I brought was an article that was research based on it was mental health services for veterans. And it was very interesting because in the article, it talked about the perception of care was actually more important than access to care. So even if there are providers and access that's available, it was their perception of whether or not they felt like it was available to them. So that was, obviously it could be a limitation. And, as you're kind of looking at some of these numbers too, although like I said, I feel like Illinois, we're doing pretty well. But, when it comes to, mental health and especially oral health, those are two kind of very specific specialties aside from just the primary care umbrella. So I thought that was really interesting as well, thinking about the perception of oral care.
Yeah, I think that's something we see both evidence-based and anecdotally. I think that's something we obviously do a fair amount of veteran oral health programming such as this and talking to the communities, as well as rural oral health programming and having those conversations about how we get that access to care, and there's that intersection. So we hear that over and over again, that perception piece. And when we're talking about those barriers, I kind of touched upon it at the beginning of the call, but really the understanding of benefits is a huge part of it. And it's extremely technical, extremely confusing about what eligibility and access veterans have when they kind of come out of service and become a veteran. It's a very complicated process, and it can change over the years. So just that piece alone of understanding what they have, and then I think something else to recognize is there are different groups of veterans now. There's different age groups of veterans. As we kind of continue on our pathway, we're having kind of veterans that have been in different wars, et cetera. And so there's different communication pieces that may be needed. We've heard stuff about the technology changing at the VA and how people can set up their appointments, and that becoming a big barrier because people not understanding the technology of it. So to that end, it's really part of why it's so great to hear from people who are on the ground and working in the community, and the people at the state level who can maybe have a better understanding of what exactly is happening in their community, and share that out.
I think it would be helpful too, and this is something that I'd have to research, kind of and take the initiative myself, but I'm an oral health professional. I'm a dental hygienist, but to find ways to connect with legislators who are really passionate about veteran health in general. I think that would probably, how would you recommend, like, do you guys have any recommendations or what you've seen in Iowa, what worked well, or how did they go about doing that?
I will pause before I jump in and see if there's anyone from Illinois on the call that wants to chime in. I don't want to talk over any local voices. Um, Well, I would say my advice is just reaching out, starting with your local legislators, your local reps, and reaching out for a conversation.
Mhm.
I think, again, that can seem really intimidating. So, something we talk about is legislators are just people. They're just people doing a job, and their job is to hear from their constituents. So when we do advocacy work, we're very often doing it at the federal level. And something that we hear over and over is that they want to hear from their constituents because their job is to serve their constituents, and they want to hear about what is concerning to them, what means the most to them, what they need. So that education piece is really important. So you could approach it of, I'm in oral healthcare, I'm an oral healthcare professional, and I want to talk about veteran oral healthcare. And again, that's why we kind of package those data points, hopefully in a way that you can really easily send it along or copy it into your information, kind of that top level, to kind of get the conversation started and show them what it looks like in their state. Let's see, Debbie's saying you are in Northern Illinois and don't know of anything but by us for dental veteran care. Okay, so Debbie, are you saying there's no veteran access for care in Northern Illinois? Am I interpreting that correctly? If you're able to come off mute, I would invite you to share more. Okay, yeah. So, and Megan, where are you located again?
I am in East Central Illinois, so I am probably 2 hours south of Chicago and 2.5 hours, and then an hour north of Champaign. I'm in Iroquois County, and we are considered a rural county where I think we're like the first or second largest county in the state of Illinois, but one of the less populated. We're very agriculturally based. So, just access to where a lot of the rural healthcare challenges that you're talking about, that is a very true depiction of our healthcare in our county. So, and the challenges. So, pretty much, unless if our elderly don't have insurance, they're not getting dental care. So,
Yeah, yeah. I think something else that we often hear from folks, I think it was an Iowa call that we were on, of those more rural places. Sometimes if you're close to the border, you might be actually getting care across state lines because there might be a VA location that's closer to you that's actually in another state. And I know obviously when we're talking about kind of land mass and area, it's nowhere near as big, but when we're looking at New England, whereas actually that's my home area, I know that they are busing veterans down from northern New England, from Maine and Vermont, down to the Boston area where there's more access to care. So good that there's maybe a transportation solution, but that's a heavy time and kind of feasibility burden to get to there.
one of the struggles I think that is just so unique to oral health challenges in general is, especially since COVID, we've seen the benefit of telehealth, telemedicine. And, with oral care, that's just, something you can't do, through that type of format. So I think that's just another barrier. And then you can have to think about access to internet and, are people able to use it? There's other barriers to that. But yeah, that's just kind of something that we have to work through as well when we think about dental care. We do have a hospital that is rural to us. It's about 50 minutes away, and they have a dental clinic that does accept Medicaid. But again, they're overloaded and it's a 6-month wait time just because there's no other places that accept that type of those subset of patients. So again, you might have one, but then you are going to be overloaded. So
That's a really great point. Thank you, Megan. Have you had any other success stories in Illinois? Any one-offs like Veterans Day or anything that you've heard of that has been really successful?
That's a good question. I have um not particularly geared towards veterans. I know like some colleges, because I teach at Parkland College, we have like uh, a Smile Healthy Day where veterans or volunteers come, dentists and our hygiene students and hygienists come and volunteer to offer care just to underserved people. We partner with the FQHC Francis Nelson, and they kind of help feed some of our patients as well to make sure that it is people who truly need the care are the ones receiving the care. So those are the types of things that I'm more aware of, not necessarily specific for veterans.
Okay. Yeah. And I wonder how many of those patients are veterans and maybe.
Yeah, if any of them are, that would be a good question to have in a survey.
Yeah. And like I mentioned earlier, having that on the paperwork is key moving forward as well.
Yeah.
Well, I wonder, Liz, if we should launch one of our polls now. Um, we have a couple polls that we want to get some of your ideas from. I will start. Let me find it here. Okay, I'm going to launch this poll. Is the veteran oral health priority areas? What do you believe are the top priority areas for veteran oral health in your state? So I will launch that and just wait for some results here. I know it's
They're all kind of good.
a question. I know. I know here in Oregon we have access is a priority. We do not have many FQHCs that accept Medicaid, so it's definitely access where I'm located. Okay, looks like we've got our responses. I will go ahead and share the results here. It looks like 3 out of 3 access to care, workforce development. That's also a huge issue right now in Oregon. How is that in Illinois? Are you guys having a workforce shortage? Do you feel that?
Yes.
Yeah.
Yeah.
Are you
Yeah,
currently?
we are, since COVID, we're seeing a major shortage in just dental professionals, dentists, dental hygienists, specifically getting dentists to come to our rural communities. I worked for a dentist for 10 years that was in our community for 40 years in practice, and we had to close because we couldn't find a dentist that would come. So it's just, I think it starts in education, where as far as you think about the cost, you think about even if you have more dentist acceptance rates might increase at universities, but does that guarantee that they're going to come down to the rural areas and work? No. So, definitely workforce shortages. And since COVID, that highlighted a lot of our issues. So, and the same with dental hygienists, we have them available more so in rural areas compared to the the dentist aspect. But again, just overall, we saw a huge exiting of hygienists during COVID. So I think we're kind of just still dealing with the effects of COVID with that.
I'm curious, this is kind of a side question, but I'm curious, do you have rural pay incentives in Illinois? I know in Oregon, where I was working, we had like a 5% pay incentive to get people to work in rural areas. You're a hygienist, so you'd probably know if that was
I
available.
wish there was.
Yeah, I know it's not
Um,
feasible everywhere, especially with FQHCs, but I did find when hiring that was a huge plus. I mean, it was a draw.
Yeah, we definitely don't have anything like that, and I think it would be great if we had, funding for, um, starting to get into practice, to go into this field. I think I was talking with another one of my students I'm advising. She's in North Carolina, and she was saying how she was in some other webinar call, and it was, just talking about the cost of dental school, how long it takes to kind of get to that neutral zone out of debt is 7 years to get out of debt from dental school. And then to make a profit, how do you accept Medicaid patients? Because with the way the business model is set up, it's just really, really difficult for dentists. So you can't even put the blame on, oh, it's just because dentists don't want to come to the area. Well, there's just so many factors involved.
Yeah, I think that's a really good point. I have another poll that I'd like to launch. Here, I'm going to pull it up. This one is, which of the following resources would you use most in your work with veteran oral health? Just curious, I want to hear from you. Thank you, Debbie. Debbie put in the chat, our medical services are about 90 minutes away and hard to schedule. Yeah, that was similar to the FQHC that I worked in Oregon as well. Transportation was an issue, especially when you're 90 minutes away. Okay, I have all responses. I will go ahead and share the results. Looks like educational materials was the top answer, and then research findings. So yeah, I hope that what we presented today is helpful.
I would say mostly with the educational materials, if there were research findings, I wouldn't be sharing it with them. I would be pulling facts and spitting it out to them kind of aspect. But yeah, I think the educational materials would be ideal, especially with rural. Most of the veterans that I see right now are elderly. So
Okay, well, thank you so much. Liz, do you have anything to add to that or any additional questions that you may have?
I don't think so. I think we can pull up our next steps piece. I guess I will add as Rahel's sharing her screen. Thank you for participating in that, sharing in the chat and answering those polls. We don't have them just there as a process point. We have them there so we can kind of understand what we can develop out next for local stakeholders to use, what's most valuable with the data that we have. So we really appreciate everyone contributing to that. We can go to the next slide. So we're going to put a link in the chat here. There are CEUs available for this session today. If you attended the entire session, you can request those CEUs. We have an evaluation attached with that CEU. Please fill that out. Even if you don't need a CEU for today's session, please fill out the evaluation. It helps us make these more effective and adjust as needed so we're best serving oral health stakeholders like yourself. This session is being recorded, and we will put the recording as well as resources and information from today's session on our website. And again, there's links on today's resources on vet dental data. So we encourage you to visit that site, use it, share it out widely. And I will just add here that we're always available for questions. So if something pops up or you share with a colleague and they have a question, please follow up with our email. Get in touch. We're happy to continue the conversation after this session. We can head to the next slide. And we're just ending with veterans deserve equitable oral health. So thank you for being part of that conversation, for being a champion of that in your state, in your local community. And we hope everyone has a wonderful day and a wonderful weekend. Take care, everyone.